Welcome to the Birth Squad, the podcast designed to empower birthing individuals with real insights from two Black female physicians. We're here to guide you through your health journey, one episode at a time. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijalma Bello. We are two OBGYNs and longtime best friends, and we're here to help navigate you through the world of reproductive health.
Real women, real stories, real experts, and the facts you need to know.
Tune in every other Sunday, and don't forget to like, follow, and subscribe.
Ready to join the squad? Let's get into it.
Hello, we are back with the Birth Squad. We have a wonderful interview in store for you today. We have the Lynn Schulte of the Institute for Birth Healing and the Center for Birth Healing here with us today. Welcome to the Birth Squad, Lynn.
Thanks so much for having me. I love any opportunity I get to talk about what I know and to help moms have better births and faster recoveries too.
We're so happy you're here. Do you mind introducing yourself and kind of sharing the story of how you came to found the Institute and the Center for Birth Healing?
Sure. So I was practicing PT for over 20 years. We moved from Seattle to Boulder, Colorado. I had to start my practice all over again. And I started just seeing postpartum women in my practice. So I wasn't, which is really unique for most physical therapy practices, is that, you see a mixture of all different kinds of people coming in. But when I started my practice, I was only seeing postpartum women. And that allowed me to find these patterns that I kept seeing in every single person who laid on my table. Like, there it is again. There it is again. And I figured out what was going on in their body and mainly in their pelvis. And I was like, why am I feeling this? Why are the bones doing this? And I looked into the research and read some books and articles on, what the mechanics of birth. And I went, oh, these mamas, their pelvises are stuck in a birthing pattern. Like their pelvises, we just all assume that the bones go back to their original position after a baby comes out. And that is not what I was finding in my practice and in these mamas. And they're complaining about pelvic pain, back pain, pain with intercourse, all these things. And, if you recognize the anatomy, that the pelvic floor muscles attached to those bones that have to splay apart for a baby to come on out. And when I learned how to bring the bones back together again, my mamas were getting out of pain in one session. Their pelvic floor muscles were able to function so much better in one session. And I was like, wow, I have something here. And I really wanted to get the work out into the world because I knew I can't see every single mom in the world. So that's when I founded in 2016, I founded the Institute for Birth Healing to help train other practitioners in what I know about the postpartum body. And then in doing all the postpartum work and seeing those patterns, I recognized, well, shoot, this is what we got to look at in pregnancy. This is what we've got to be aware of to help moms have better births so that their postpartum isn't so challenging. And so then I created a postpartum course as well. And I have been traveling the world teaching other body workers how to help support moms in pregnancy and postpartum. And it's just such a joy for me. And every day I'm still in the clinic 2 days a week seeing mamas. And I am constantly amazed at the amount of change that I can make in a postpartum body. And it blows my mind every day. So I absolutely love being able to share what I know with others. And thank you for giving me this opportunity, you guys.
Absolutely. Thank you for coming because your work is so important. And it is amazing to see someone who's so passionate about what they do. I want to ask you, because we see patients all the time who come in reporting pain in and outside of pregnancy, but they don't see the importance. They're like, why? I don't have time. They don't understand the importance of going to physical therapy. Can you talk a little bit about how ignoring this issue, how does that affect their recovery? And talk a little bit about what a visit with you would look like.
Okay. Well, so first off, everybody needs to understand that our bodies are meant to carry and birth a baby without pain. Now, I don't mean birthing shouldn't be painful. That we all know that is intense, but the body should be able to carry a pregnancy, carry a baby, and there shouldn't be back pain. And unfortunately, there's some providers out there that are just making it feel like it's a normal thing, and that, oh, well, you're pregnant, yeah, you have back pain, you're pregnant. But that to me is a sign there's a dysfunction going on in your body. And that dysfunction, especially pelvic pain, back pain, it may impact the birth process. And so it's super important. And every year I do a birth healing summit, and you guys were a part of it this year. I got to interview you for my summit. But I speak to professionals all around the world, and I speak to midwives and body workers, and they are sharing with me that the pains that we don't address during pregnancy, and maybe luckily they go away. So they like, oh, I'm not in pain anymore, but they show up in the labor process. And it slows things up. It makes it harder for baby to come on out. So sometimes the pains that women are having in their pregnancies is their body's way of saying, hey, check this out because there's a problem going on here. And sometimes it's the baby's position in the body. Baby is more transverse, or baby's head is heading into one hip, and now we've got all this hip pain going on. Well, that's telling us there's restrictions that are causing baby to go where it goes, because baby goes where there's space. And that's why it's super important for anybody who is pregnant or wanting to birth that we address these issues in your body so that your baby has an easier exit. You have a smoother birth. And we're sitting way too much. Our pelvises is being locked up. We're tight. All of our sitting habits, all of our habits that we do, whether we're sitting and we're sitting on our tailbone and we're pushing that tailbone forward, that is closing up the area that the baby needs to come out. So we need to be opening our pelvis and working on squatting more and getting the flexibility in our body. And so sometimes the pain is because of tightness, and other times the pain is because there's too much laxity that happens in the pregnant body, because some women are really what I call bendy. They're really flexible, and their flexibility, when we add pregnancy hormones to it, it causes that body is like, I can't hold this together. But a lot of times that is because of the patterns of the way they're using their body.
Okay, Kamisha, let's talk about the most common complaint we hear from our pregnant mamas: back pain and pelvic pain.
Whew, yes, it comes up all the time. Here's the thing, just because it's common, though, doesn't mean it's normal or that you have to suffer through it.
Exactly. There's a lot happening in the body. Hormones like relaxin kick in early, and they're literally relaxing your joints. Interesting, right? The hormone is called relaxin, and actually relaxes your joints, your ligaments, and especially in the areas around the pelvis to help prep for delivery.
Right. But the flip side of this is that it can make women hypermobile. This means that the pelvis gets a little wobbly, posture shifts, and suddenly you've got low back pain, hip pain, even pubic bone pain.
And so that's why it's so important to know what is your baseline. If you already deal with back or hip pain, it's likely to worsen during pregnancy. So getting into the best possible shape before pregnancy is key, and addressing any pain that you have prior to pregnancy as well.
Yes, strengthening your core and pelvic floor before and during pregnancy can really help support the growing belly and take pressure off your back.
And listen, if you hit a point where it hurts to walk, roll over, or get out of bed, that's not just pregnancy pain. That's a sign to get checked out. Physical therapy, chiropractic care that specializes in pregnancy, and even especially pelvic floor therapy can make a huge difference.
Absolutely. Don't wait until you're barely moving. Early care is everything. Pregnancy is a marathon, not a time to push through pain and suffer.
Say that again, because healthy mothers need to make sure they are having healthy pregnancies.
100%. Let's get back to Lynn and her interview.
So pain is a complicated issue that's not that, it's not there's one thing that you should just do because, oh, you got back pain, you should do this. That back pain could be because of a lot of different issues. But I think it's really important for people listening into this that pain is a sign of dysfunction. Your body is meant to carry this baby without pain. And if you can address that pain by seeing a pelvic floor physical therapist, I feel it's a more holistic kind of approach to the body and get that support so that you can have as smooth of a birth as possible.
Lynn, I mean, your expertise is phenomenal, and I'm sure that you have helped a lot of women and you've also trained a number of practitioners. Are there like any particular standout stories or cases that you feel like you could share with us that have been transformative for a birthing person in their pregnancy or their birth?
Yeah. Well, one really stands out for me, and this is from a midwife who reached out to me at like 36 weeks and was like, "Lynn, I'm having this symphysis pubis." And when she came into my office, she couldn't take one shoe off by herself. Like it was painful for her to slip in standing, to slip a shoe off. And when I evaluated her, there was nothing going on in her body. Like there was no physical tension, no muscles that were tight. There was no, like her symphysis pubis joint, usually with symphysis pubis, like one side doesn't move as well as the other. But I'm like, there's nothing going on, like nothing physically that I could find wrong in her body to help her with. But the only objective finding I found is that I listen to see if there's a flow of energy down your legs. And in acupuncture, that's what they're working, the chi of the body. They're trying to help get that to move through our body. And so I'm kind of tuning into that and seeing, does it flow down one leg? Does it flow down the other leg? Does it flow down our root chakra? Because the root chakra is what needs to open for baby to come on out. So this client, this midwife that I'm working with, 40 weeks pregnant, her left side leg had zero flow. It was blocked. It was blocked. And the right side had some good flow to it, but the left was blocked. And so energetically, I know that the left side of our body is our feminine energy. And so it's about, our femininity. And so I asked her, I'm like, how do you feel about becoming a mama? She's like, oh, I can't wait to meet my baby. And there was no change in her body. And then I asked her, so what's the relationship with your mom? And she's like, my mom's a narcissist and I don't know. I don't want her at my birth. And I haven't figured that out yet. And you know what? Her energy started flowing down her left leg as soon as she started talking about her mom. So I knew that blocked energy was about her mom. So the body can't lie. The body gives us signals. And I knew how to read her signals. And so I said, well, what do you want to do for this birth? And she thought about it and she goes, I think I'm going to have the baby and not tell my mom until 24 hours after the baby's born. And she walked out of my clinic having contractions and had the baby 5 hours later. And she was able to put her shoes on with no pain. Isn't that wild?
I mean, we carry so much stress and emotion in our body. Well, I'm curious, you're saying that sometimes people, when they get pregnant, these symptoms manifest. Should people be doing anything when they're like preconceptive, like when they're thinking about conceiving? Like, what do you recommend in that situation?
But Dr. Thomas, that would be so ideal. So ideal. I really wish for those people who are planning to start a family that they would come get assessed by a pelvic floor PT, someone that I've trained who understands this more holistic approach to the body and looking at our energy flow and looking at the balance of energy in our pelvic space, our pelvic floor muscles. Can they function well? Can they relax well? And really try to do their best to address whatever issues are being held in their tissues. Because I've always wondered, in working with pregnant mamas for the, almost 2 decades that I've been specializing in this area, I've always wondered, like, why do some women have 7 and 8 hour labors and others have 40 and 50-hour labors? I've always wondered that. And what I've really come down to is that I feel it's what we bring in our body, in our mind, and in our spirit to the birth. And so if we can address physically, like let's help balance out your pelvis, let's get your pelvic floor muscles nice and released. I even work with the cervix internally to make sure that the uterosacral ligaments are nice and balanced and cervix is right in the midline. And, so that we've got conception is going to be as smooth as possible, hopefully. And also working with that energetics and seeing where do we have stuckness in our body. It doesn't have to just be held in our pelvic space. It can be held in our heart, our neck, our shoulder, like anywhere in our body. And so I think, for those who are considering becoming pregnant, like really do a scan of your body, check in. And so I work on a deeper level with women to help them shift their limiting beliefs that bring to them the experiences that they're having in their life. And I know this is much deeper than we probably wanted to go, but it's just so important. I mean, we need to take responsibility for our own lives and recognize that the beliefs that we carry in our mind and our subconscious and unconscious mind are truly driving us in our life. And so if we want to have the smoothest birth possible, we need to address those limiting beliefs. I encourage all my pregnant mamas. I'm like, write about your fears around birth, because it's the women I see this, and I'm sure you guys see it in your practices as well, that the women that come into me and they go, I do not want a C-section. I do not want this to happen in my birth. You're like, they are just dead set against something happening. They're the ones that ends up happening to, right? Right. And so I tell my mamas that come in, I'm like, have a plan, have a really good plan, and throw it away. And you need to be in the moment. You have to be in the moment, and you have to try to do your best to be flexible, with birth. Because as I'm learning, one of the interviews this year in the Birth Healing Summit was with another midwife who wrote a book, The Wisdom from the Womb, and that the birth is actually the baby's birth. You may be carrying this baby and you may have a sense of what you want for your own birth, but it's actually the baby's birth. And there's a reason that certain babies come out a certain way. And so when I'm working with mamas who have breech babies and, they really want help flipping baby, we do all the work. I had one mama come to me and we spent 2 hours working with her, and we worked physically on all the tight structures that might have kept baby in that breech position. Baby was head up underneath a rib cage. And then we worked energetically and we released the trauma from our first birth that was definitely being held in your pelvic space. And I never heard from her. Usually when babies flip, you get a text message and go, oh, baby flipped down, yay. But after we did all this beautiful work together, I said, you know what? It's this baby's choice to come out the way that this baby wants to come out. You can try everything that you can. This baby may still choose and need to come out the way the baby comes out. So we have to let go of that control.
All right, Kamisha. All right, this part might sound a little bit granola to some, but I want y'all to stay with us because the mind and body connection is so real, especially during pregnancy.
Yep, we're going there because your body holds stress, and not just in your shoulders and your jaw, but deep in your pelvis too.
Exactly. And when we think about the pelvis, it's not just structural, it's also energetic. In a lot of traditions, it's an area known as the sacral chakra, and it's the space tied to creativity, intimacy, and emotion.
And if you think about it, the pelvis is literally where life begins. But it's also where we carry trauma, especially for folks who've experienced sexual trauma or emotional wounds. That tension stays stored there.
Now, on top of all of that, imagine you're growing a whole human in that space, pushing on all that stored emotion, those tight muscles, all that energy. And we're not addressing it. And that stress can really show up potentially in labor.
Because y'all, stress isn't just a vibe, it's chemical. High stress raises cortisol levels, which can affect your labor, your milk supply, your recovery, all of it.
And that's what I love about Renisha's story. When we look back at season 1, she wrote down all of her fears about her birth and she said them out loud and really processed them before labor. And that's what we want for y'all too.
Exactly. Don't carry those fears silently. Journal, pray, talk to your birth team, your therapist, whoever you need to release it.
And while we're on it, your birth plan is exactly that, yours. You don't want somebody in the room? They don't need to be there. You feel uncomfortable during labor? Say something. Something changes in the plan? It's okay. Let's pivot.
And like our girl Lynn always says, this is your birth, but it's also your baby's birth.
Yes, so have a plan, stay flexible, consider the what ifs ahead of time so that they're not so scary if they actually happen. And most especially, ask the questions and get your answers.
Because when you walk into birth informed, calm, and tuned in with your body, that's when magic really happens.
All right, now let's get back to Lynn. I really love your comprehensive approach because like you said, it's body and mind and how it's all integrated and working together for a particular outcome. One thing that you mentioned earlier was that, sometimes some people who have their knees that kind of like rotate back. Are there any other signs that you as a PT are aware of that could be a sign for someone that has unresolved pelvic issues?
The symphysis pubis pain is definitely an issue with too much pressure anteriorly sometimes, but the sacroiliac joint, I would really want women to be aware of their habits and how they stand, because as we get closer to labor, our pelvis just gets more and more mushy and relaxed with the increased hormonal change cocktail that's getting it ready for that birth. And the body needs some symmetry. And we all have postures that we stand with all of our weight on one leg, and then we get right SI joint pain. So like, understand, where's your pain? Oh, it's always on the left. Oh, you're always standing on the left. Huh, I wonder if it's related. Or when we go to sit down on a chair or couch, do we always cross the right leg over the left? Do we sit in a couch and we tuck our legs off to one side, and now we have all this pressure on the left side of our pelvis? That's what I'm asking my moms and trying to figure out. What are the habits that you're doing in this pregnancy that might be causing some of the pain that you're experiencing? And so those are the things that mom have within their control. One other point about that, how are you driving? Because when we go to drive, we always reach with that right leg for the gas and the brake. And if you guys are watching this on video, the shoulders, like we should be sitting, when you go to sit in your car, your pelvis should be nice and even, and then you just reach that leg out without shifting your pelvis. So if you have even pressure on your pelvis, and then you just go to extend your right leg, you should be reaching the pedal without having to twist your pelvis to reach for the pedal. Okay. So I think there's a lot of us reaching, and I was guilty of this. I was having some right SI joint pain, and I just moved my seat up an inch, and my pain is much better. So, and I'm not pregnant, guys. So there's so much that we're doing in our bodies. And then we also have hidden tensions too, that, sometimes we've had falls or injuries or past experiences that are impacting our body and our tissues. And I would have to say the tension in our pelvic floor muscles is something that must be addressed prior to birth. I call the pelvic floor muscles the stoplight for birth. Okay. That if we have red light tone in there, that red light tone means I am not moving, like I am not relaxing. And it's also a sign baby's not coming out that way. If we have yellow light tone, it just makes it a little bit harder. Baby's got to work a little bit harder. You're going to have to push a little harder to get that baby through. We want green light tone in there. And I'd really encourage everybody who is pregnant listening to this podcast to check out your pelvic floor muscles and to see if they are springy like a trampoline. So I like using my thumbs when I access the pelvic floor muscles because it's just easier. So my right thumb will put in my finger in vaginally, and don't push down at 6 o'clock. If you think of the vaginal opening as a clock, at 6 o'clock is your rectum. So don't push down right at 6 o'clock, but come over at 4 and 5 o'clock with your right thumb and press down at an angle. And do you get a nice springy, like it gives and then it bounces right back? That's green light tone. And then take your left thumb and put it in and go at 7 and 8 o'clock, insert it as far as you can, and then press down at a diagonal and feel if those muscles give and do they bounce up back. We want nice, even, bouncy tone side to side.
Okay, now that was a visual, right, Kamisha? I know some of y'all listening are like, wait a minute, should I go grab a mirror and get some gloves real quick and try it?
Okay, listen, be honest. How many of y'all are curious and low-key ready to try it? We'll give you a moment.
Okay, seriously, but all jokes aside, this concept is really fascinating because that springy bounce back that Lynn described, that's what we're looking for a healthy pelvic tone.
Yes, and just like we hold tension in our shoulders, we can hold too much stress, trauma, and tightness in the pelvis. And most of us don't even realize it.
Exactly. This is why pelvic therapy is not just a trendy thing, it is foundational, especially when you're dealing with conditions like chronic pelvic pain. pain with sex, or tension in your pelvis before pregnancy?
And especially during pregnancy and postpartum, because those muscles go through it. Carrying a baby, delivering a baby, whether vaginal or C-section, all of it impacts your pelvic floor.
Right. And sometimes if those tightness or imbalances go unchecked, it can lead to more long-term severe symptoms like leakage, prolapse, painful sex, things that nobody told you about until you're living it.
Exactly. So if you've been wondering if pelvic floor therapy is for you, this is your sign. Don't wait. Start before pregnancy if you can, and definitely postpartum.
All right, let's get back to Lynn because she's about to explain why that balance matters and how it literally can impact how your baby moves through the pelvis.
If we have tension on one side, then that baby can't come out that way. The pelvis can't open, and now the baby is forced out to the other side. And then that side of the pelvis gets more tension on it. And then you might have some issues postpartum because that side gets more pressure to it. But I had a doula that came to see me, and she was pregnant with her second baby. And she told me her first pregnancy that she was trying to do a home birth, but she got to 4 centimeters dilation and never got past it. And so then she had to go to the hospital. She got an epidural, and then baby came out vaginally. Well, when I saw her in her second pregnancy, she still to this day wins the award for the tightest pelvic floor muscles I have ever worked on. You guys, they were like bricks in there. There was zero give both sides. And I'm like, well, no wonder you had to go to the hospital and get an epidural, because the epidural can bypass the tension in the pelvic floor muscles. So we worked with that. And I'm really good at getting pelvic floor muscles to release in like one session, but it took us 3 sessions to get her pelvic floor muscles to have a little bit of bounce and give to them. And she was successful having a home birth.
Oh my God, how amazing.
I swear, had she not done that work with me, she would have ended up in the same pattern and needed the epidural at the hospital again.
Lynn, these are such amazing insights. What are some common misconceptions that you encounter from clients, and how do you shift those perspectives?
Yeah, one of the biggest ones is that women are told, in some childbirth classes are still perpetuating this myth, that women during pregnancy should be doing thousands of Kegels a day. And so what people need to understand is that, from your tailbone to your pubic bone, from your sit bones on either side, we have this group of pelvic floor muscles. And those pelvic floor muscles need to have flexible strength. Okay. We don't want them too tight and too strong. That makes it harder for the bones to open up, for the muscles to lengthen, for baby to come on out. And so I don't want moms like, yes, first trimester, early second trimester, do some Kegels, because the act of women carrying a baby does weaken the pelvic floor muscles, just the heaviness. However, it doesn't weaken it to the degree that we are afraid of. And so people are like, gotta be strong, gotta be strong. Well, what they're doing is they're bringing that tailbone closer towards the pubic bone. They're bringing their sit bones closer together, and you're closing down the pelvic outlet that the baby needs to come out of. We need the opposite to happen. We need the tailbone to go backwards. We need the sit bones that you're sitting on to splay apart for baby to come on out. And so we need to learn how to lengthen those pelvic floor muscles more than tighten them for birth. And one of the best ways to think about that is, what do you do when you have a bowel movement? Like, especially someone who's constipated and figures out how to have a bowel movement when they're constipated are probably going to do a much better job of pushing during labor than someone who's never had to push for birth or, having a bowel movement at all. Okay. And so that is one of the biggest things that I want pregnant people to know, is that it's more important for you to figure out how to push effectively with a lengthening of your pelvic floor muscles versus pushing and tightening your pelvic floor muscles. Okay. So if we train and constantly tighten, when you go to push, you may be tightening versus relaxing your pelvic floor muscles. So what moms can do is lay on your side, put your fingers on your anus where the stool comes out, and then practice bearing down. Practice feeling something bulging into your hand, because we know that women who actually, when you go to push and you tighten your pelvic floor muscles, it's called reciprocal pushing, you're at a greater risk for tearing into your anal sphincter muscle than those that lengthen when they push.
Okay, pause. Because Lynn just gave us another exercise, and it is a whole gem.
Whew. Listen, y'all, go ahead and bookmark that part or try it later in the privacy of your own home, but please try it.
Because what she's saying is straight up facts. Pushing is not about squeezing everything tight. It is about lengthening the pelvic floor, letting those muscles open so that the baby can actually come through.
Right. The mistake a lot of people make is thinking bearing down means clenching. But if you're tightening while pushing, you're actually working against yourself and increasing your risk of tearing.
And here's the wild part. Pushing is like the grand finale of labor. And how many of y'all got any rehearsal before showtime? Most people are just winging it, and that is a problem.
You wouldn't run a marathon without training, but we expect women to just figure it out in the moment, often numb from an epidural with no clue if they're even using the right muscles.
So here's your reminder, practice before Labor Day. Practice before Labor Day. Find those muscles. Know what it feels like to bear down and lengthen. Do not clench.
And listen, can we talk about the poop fear real quick? Because yes, sometimes pushing means pooping. Poop happens, and that actually is good.
Exactly. And let me tell you, as soon as I walk into a room and I smell that, I know you're doing the work. And that's a good sign.
Zero shame, okay? We're professionals. We see it, we clean it, we keep it moving. That means you're pushing from the right place. Your body is doing exactly what it's supposed to. Don't worry about it.
Okay, enough shit talk. Let's get back to the interview.
And so that's one of the biggest myths that I want women to change in this world is let's help every person to figure out how to push before you go into labor. I would have to say that in my postpartum clients, I hear it way too often. Well, they told me I didn't know how to push. I had to tell you guys, when I'm working with my clients, my pregnant clients, and come to see me in my clinic, and one of the biggest things I do is I teach them how to push in all different positions. And guess which position is the hardest position for them to figure out how to push? On their backs with their legs up. Nobody gets that right off the bat very often. Okay. So I practice on their back and yeah, they can't get it. So then I get them in side lying and we practice in side lying. And then I get them up on hands and knees and we practice in hands and knees and they get it even better on hands and knees. But then I get them into tall kneeling. Totally get it in tall kneeling. They totally get because it's just like pooping. It's the same position as pooping. So I need to know why are we still birthing on our backs?
Yes. Lynn brings up a very good question. Why are we still pushing on our backs when oftentimes it's the least effective position for pushing?
To be honest, it's a mix of reasons. First, because you're in a bed. Let's be real, hospitals are set up that way. Second, it's the epidural. Once that's on board, walking, squatting, or being on all fours might not be reasonable or safe. We don't want you to fall trying to chase a more quote unquote natural position.
Third, it's what a lot of traditional OBs are trained and are comfortable with. So it gives us the best view and the best access if we need to intervene quickly. But here's clearly that does not mean that you have to push on your back. You absolutely have options.
100%. And this is where planning with your birth team and especially a doula ahead of time can really help. They can walk you through the different positions that are safe with and without an epidural, like side lying, supported squats, hands and knees on the bed, or using a peanut ball.
And we say it all the time, have a plan, but be flexible. Because sometimes the baby's heart rate might look better in a certain position, or things change in the moment and you might need to pivot.
The most important thing, know your options before delivery day. That way, you're not trying to learn and advocate in the middle of labor. You can say, hey, can we try side lying? Or can I use the peanut ball?
Exactly, birth is not a one size fits all. But the more you know, the more you can advocate for what feels right to you and for your baby.
Okay, let's get back to Lynn and see what she has to share with us with her last final thoughts.
Don't worry about pooping, everybody. It's a good thing. You want to poop. You want to poop.
And I think our job as birth workers is to encourage people to push in positions that they're most powerful in. And so when I come into the room, if they're on their back, I always look at the nurse and I ask, what is their most powerful position? Right? I want to know that the nurses are encouraging them to push in different positions. So I love to hear that you love it too.
Yeah.
But we need to be open to that for them. I think we just need to encourage people to do what's powerful.
Absolutely. And so I think it's important. Like, I try to make sure that my pregnant clients have no fear of any position. I will tell them, well, you're most powerful in a tall kneeling position, but I'm like, you need to get into whatever position this baby needs to come out in. There's a great exercise I hope everybody listening to can check out on my YouTube channel. It's an exercise to close up the bones after birth. And we use the adductors and the abductors of the hips to just kind of help bring the bones back to their midline position. And so I can put it in the show notes. I just wish, actually, I would love it to be standard of care that after a mama gives birth, we just do this. It's a 10-second hold where we have the knees together and we squeeze the knees together, and then we bring them shoulder width apart and we squeeze the knees together for 10 seconds. We bring the knees out even wider and we squeeze the knees apart or together, held in these different positions. And then we do the opposite. So knees are together and we resist them going out. And then we put knees shoulder width apart. We resist them going out. And then we put them wide and we resist them going out. And that motion can help bring the pelvis back to its original position better. And if mamas just did this right after birth, like, their pelvis doesn't get stuck in any position, right? Because things are loosey goosey after baby comes out. And if we just help bring them back together, we could minimize the amount of pelvic pain and back pain that women experience after having babies. I truly believe that.
I love having experts like you on our show because we are all learning.
Yes.
Yeah, just thank you for that. Leading to your YouTube, I wanted to know, where can our listeners connect with you or learn more about your courses or find resources that you offer?
Yeah, so the Institute for Birth Healing is an educational platform for people who have a license to touch. So those courses are mainly for PTs, OTs, chiros, midwives, you guys, So there's all different kinds of courses on that website. But I also, on that website, which is the instituteforbirthhealing.com, is also a directory of all the practitioners that I have trained who know how to help affect the bones after birth, how to prepare bodies for birth. So those practitioners are on my directory there. So please check out that website for that. And then the Center for Birth Healing is my clinical practice. And I work with mamas in person and via Zoom, especially if mamas have had birth trauma. I work really well with people who, have pain after birth. Their C-section scar is really painful. They can't touch it. Their birth was really traumatic and they're thinking about wanting to get pregnant again. It'd be a really good time to kind of just help get that healing work done. So I can do that via Zoom with people there. Okay. And then all my social media is mainly Institute for Birth Healing is my focus. So the videos I'm talking about are on my YouTube channel, Institute for Birth Healing, and we'll put those links in the show notes too for you guys too.
Thanks so much for coming on our podcast. We enjoyed it so much. It was enlightening and so passionate, like it's what we're all passionate about. That's why we all do what we do.
Yeah.
Before we close, I was just curious, was there anything that you just wanted to share or leave our listeners with?
Yeah, it's so important to take care of your body before pregnancy, like even before getting pregnant, but during pregnancy, like take care of your body, listen to those aches and pains because they're telling you something. And then after birth, healing can always happen. So just always know if someone who's, has older children might be listening into this, please know that healing can always happen.
Well, thank you so much. It's such a pleasure having you today. And we appreciate you tuning.
Yeah. Thank you.